Okay. Hi, I'm Jessica Vickers. I have my Pharm D. I just graduated from ISU College of Pharmacy almost a year ago. I'm currently doing my residency, which is basically continuing education beyond being licensed. And today I'm going to tell you about cholesterol. If you guys have questions or comments while I'm talking, feel free to just speak up. So today I'll go over the types of cholesterol testing, the meaning of cholesterol levels, and then treatment of high cholesterol. So first we'll go over types of cholesterol and what you see on a lipid panel. So the first type is LDL, which is considered your bad cholesterol. And here's a great picture. It's considered bad because they form plaques here along the artery lining that can either occlude the vessel like this is, or they can break off and go through the bloodstream. And then we have HDL, which is considered your good cholesterol, and that basically grabs the bad cholesterol and removes it to the liver, where you just pass it out of your system. We have triglycerides, which are extra calories from your diet, and a lot of triglycerides can increase your cardiovascular risk. And then you'll see total cholesterol on your lipid panel, and that's the equation for it. So it's HDL plus LDL, and then 20% of your triglycerides. Now we'll go over how you cholesterol test. Oh, good. So you do a fasting lipid panel, and fasting means that you don't eat or drink anything except for water for generally 12 hours, but 8 should be okay as well. And some guidelines say that you should test when you're 20 years old, and then thereafter every 5 or so years if your test is normal. You may want to test younger if you have a high family history or a parent with really high cholesterol. But then the U.S. Preventative Task Force says begin at 20 if you have a high cardiovascular risk, such as diabetes or smoking, high blood pressure, and then not until 35 if you're a male, or 45 if you're a female, and you don't have those risk factors. So what's considered high cholesterol? Total cholesterol above 240 is considered high. LDL is the one that we generally think about, and so greater than 190 is considered high. And then HDL, on the other hand, you want a high HDL. Women generally have higher HDLs than men, and things that can affect that are exercise and smoking and lifestyle modifications like that. And triglycerides, once they get past 500, between 500 and 1,000, that's when they become a problem, and that's when we start to treat them. But generally, we target the LDL. So some complications of high cholesterol are, I kind of alluded to them before. So you can have a clot break off in your coronary arteries, so in your heart, and it can go off and occlude and block off the blood supply to parts of your heart and cause a heart attack. And then the same thing can happen in your brain and block off some of your brain tissue and cause a stroke. And in addition to that, in your legs, the picture I showed you of how it became thinner in the artery, that can cause a lessening of blood flow, so you're not getting as much oxygen in your legs, and it's painful to walk. And that's called peripheral artery disease. Did you see my cartoon? So some treatments, and first line always is lifestyle modifications, and then also some medication therapies as well. But lifestyle, like I said, is the initial step. You want to try that first to try to lower your cholesterol without medications, of course. Always the first line is no medication, and then you want to keep up those lifestyle modifications when you do add on medication as well. And so the lifestyle modifications include a heart-healthy diet, regular exercise, no tobacco, and then a healthy weight. And I won't talk any more about the lifestyle modifications because you're going to get a whole lot of that for the rest of the night. So on to statins. Statins are the most common group of cholesterol medications. They're called statins because each of their generic names ends in statin. They have differing levels of potency. So we have atorvastatin, simvastatin, pravastatin, fluvastatin, rosuvastatin, and pitavastatin. And so they're all statins. Oh, and also, so all of them except for these bottom two right here are generic, and you can get them for under $20. Some of them are even on the $10 list.
Even less than that.
Yeah, exactly. And then the bottom two are still brand name only, so they run about $200 a month for 30 pills. So the older guidelines focused more on the LDL number. You might have had your doctor tell you, oh, your LDL is above 100. That's not good. We need to put you on this medication. And so we have new guidelines now that kind of group patients into different categories based on their risk factors. And we still do look at the numbers, so it's important to get the lipid panel so you know your number, but it's less of a focus on driving down to a specific number such as 100 or 130 for an LDL value. And then each group, depending on the risk factors, will need a differing potency of the statin medication. And the 4 benefit groups are those with a history of heart problems, an LDL greater than 190, patients with diabetes aged 40 to 75 that don't have heart issues, and then using a scoring system, we can calculate a 10 risk score, and having one greater than 7.5, you need to be treated as well, or you should be treated, I guess. And so for high intensity statins, and all of this treatment is extremely individualized. You definitely need to talk to your healthcare provider and go over what risk factors you have and see which category you would fit in, or if you would fit in one of them at all. So, for instance, if you have had a heart attack before and you're less than 75, you should be on a high intensity statin. And so some examples are the Crestor and the Lipitor, and both of those reduce your LDL greater than 50%. So before these new guidelines, we were looking at the LDL value, and these patients would need an LDL of at least less than 100, but now we're just looking at reducing the LDL by a percentage. Does that kind of make sense? Okay, and so then other patients that don't fit into that above group, but still are in those benefit groups I talked about, would need a moderate intensity, and those lower about 30 to 50%. And then there's some examples there. The Lipitor dose is just a little bit lower for the moderate intensity. And then some just important facts about statins. Main side effect is headache. It improves over time. Muscle weakness or pain needs to be reported to your physician. It usually happens in your large muscle groups like your thighs, your back, your upper arms. You need to take pravastatin and simvastatin with an evening meal or at bedtime, and that's because cholesterol is produced at nighttime, and these two medications don't last in your system long enough to take effect in your body at nighttime if you take them in the morning. But rosuvastatin and atorvastatin, they last all day, so you are good to take them in the morning. And then you want to avoid grapefruit juice with these because they can interact with an enzyme in your body that breaks down the statin. And so if you drink a lot of grapefruit juice, you'll end up with increased amount of drug in your body, and that can lead to the muscle pain and some liver issues and things that you don't want. So other medications are the bile acid sequestrants, fibrates, Zetia, and niacin. These aren't used as often anymore. They don't show as much of a cardiovascular benefit, so they haven't really, in studies, been shown to help keep people alive. So fibrates, bile acid sequestrants really aren't used that often at all, but fibrates do have a place in therapy. If your triglycerides are above 500, especially above 1,000, we target that first and you get a fibrate. And that's what you're on before you're even on a statin, or you're on both of them. but combining them can increase your risk of muscle pain and weakness. And a new trial just came out about Zetia, saying that there's potential that it does have these cardiovascular benefits to where it can help prolong your life, prolong mortality, or prevent mortality. But the results of that are still they're not as strong as that of the statins. And then niacin is used to increase your HDL. Other than that, it's basically a statin-run world. I think I flew through that.
That's fine.
So, in summary, the LDL is bad, HDL is good. Notice my picture. Cholesterol testing should, but not always, doesn't have to begin at 20, but it's probably a good idea, and it should be a fasting lipid panel. And the mainstays of treatment are lifestyle modifications and then statins. And I have another picture.
Read the bottom line, because I can't.
Whenever your cholesterol goes too high, a sensor will send a signal that automatically locks the kitchen door and turns on your treadmill.
Yeah.
Any questions? Here's my references if you are truly interested. But that's more interesting. Anything?
Any questions, anyone?
No one?
No.
Okay.
Thank you very much.
Yay.